Hi, my name is Talia MK and I have with me Najib Zahran Al Rawahi, and he is Senior Consultant Invasive Adult Electrophysicist at the National Heart Center, and he is also the awardee for our Health 2.0 Outstanding Leadership. So thank you so much, sir, for being here, first of all, and I would like you to introduce yourself and your organization to us.
Sure. Uh, I'm Dr. Najib Al Rawahi, Senior Consultant Cardiologist. I am the founder of Arrhythmia Service in the Sultanate of Oman. I'm working now in Oman Heart Association, Oman National Heart Center in Sultanate of Oman. Uh, we have we are the only equipped center for arrhythmia treatment in Oman, uh, and we're serving the whole Sultanate.
That's something really important and something very unfortunate that we suffer from. So thank you so much. So you are here at Health 2.0 conference, the Winter, and you're receiving an award. You're an honoree. How do you feel to receive an award and recognition for your accomplishments?
Actually, I'm very honored to receive this award. This is sort of one of the unique award I received, and it will help in producing more care to my patients and the country.
So if anybody who wants to follow your footsteps, what advice would you give them?
For me, I was the first person specialized in arrhythmia treatment in Oman. So to start from scratch, it's a bit hard thing to do. But with determination and accommodate people understanding, it won't be very fast, but you will reach there sometime. Okay, thanks.
So how has your learning experience and networking experience has been at Health 2.0 conference, the Winter 2022?
Actually, this is the first time I'm getting in a conference with people getting more than one track. So for me, I usually attend conferences with doctors, but here we have more like administrator, some company people, people even not related to healthcare, but like to digital things. So it's very interesting for me to come here, and for sure we'll try to come more, inshallah. Yes.
Dubai would be really honored if you're here. So I would like to know that how can anybody reach for collaboration or advice? How can they reach you?
For people in the region, I mean, I'm a well-known person, so just Google me and get me there. It's not a problem. For Oman, of course, everyone has my phone number, so I get maybe 10, 20 messages every day. So I'm well connected, but of course, I'm available for any more connections.
Your email address is mentioned. Should I share it with them?
Yeah, sure.
Sure. So the email address, if you want to, you can Google for sure. But if you want an email address, it is nalrawahi@yahoo.com. So you were the first on specialized in arithmetic treatment in Oman, and how it feels to be the only one to be specialized in such an important. I think so. It's an accomplishment.
It's I think to be first one in anything is good, but in healthcare is actually it's more like a burden. It's because everyone have a problem with my specialty, especially doctors. They will call me, and the problem was how to get me. That's usually the problem, the thing. So when I started, I came back home at 2007. So I just had connection all doctors in the Sultanate. Like I went to every hospital, or just call them, and they know that me. So my plan was to each patient anywhere in the Sultanate, not only in the center I work, he can get the same care at the center. So, and that Alhamdulillah is going on very well, and now we're having good connections and. Whenever patient present to anywhere, I know about him before even the doctors know. So.
So, What advice or you will give to the people who are just finishing off their training and who wants to work in this region, like beside Oman? If you, as you're meeting different kind of people, and in this region, what advice would you give them who wants to follow, not only follow your footstep, but to how to just start?
Yeah, it's very important because I train in Canada, which is one of the highest, like more prestigious healthcare systems in the world. So to come back here and you will not find each equipment you had in your training. The aim here to accommodate and to actually the most important thing in your training is to adapt. Whatever you have, you can use and to treat well your patients. So that's a very important thing. When you start, you shouldn't demand to have the best equipment. You just try to start the service, and then slowly build up your services as needed. Because patients differ from here everywhere, and the needs are different. And maybe you can find other treatments than the one you learned before.
Thank you so much, Dr. Najib, and I'm very honored to be here with a person who was specialized for who was the first one, and I hope that people follow your footstep and become first of many other unfortunate problems we are facing and health issues. Thank you so much for your time. I hope you enjoy Dubai, and I hope you enjoy the conference. And this is Talia MK signing off. Thank you.